Hello everyone, my name is Kevin Rosario, and I'd like to take a moment to talk about a troubling trend in men's healthcare. This old mentality of boys will be boys and real men don't cry. You want to cry, I'll give you something to cry about. Suck it up, tough it out. You know, these are things we hear as a child, as a young boy growing up, which deters us from kind of asking for help and admitting that we have struggles and pains and emotional sometimes needs. You know, it's almost like this deterrence from showing vulnerability. This very dangerous trend is leading to a lower expectancy rate. You know, the life expectancy of males is about 6 years shorter than women, and the African American male is even shorter than that. There's different socioeconomic factors. People don't have access to healthcare. People don't have access to insurance. Obviously, that's a big problem. But the problem I really wanted to talk about today was when men have the ability to ask for help, but just don't ask for help. You know, sometimes they have to be near death, in fact, to actually seek help. And the largest contributor to men's early death is cardiovascular disease, things like heart attack and strokes. In 2004, the CDC reported over 321,000 deaths related to cardiovascular disease, and many of those symptoms caught early enough on can be prevented and deterred and rehabilitated from. But because men don't seek help until the last hour, sometimes they're in a terminal state. James Leon, in his book Concept in Men's Health, quoted, "Males in general tend to express reluctance to seek help when they are ill or feel less at risk than other groups. Men tend to delay medical care by a few days when they are ill, in pain, or otherwise concerned about their health, according to a recent study by the American Academy of Family Physicians in 2008 in Vitality. In this study, 92% of the more than 1,000 men surveyed confirmed that they wait a few days to seek medical advice, and more than 55% of them had not been to a doctor for a physical examination in the past year. Similarly, 80% rated their health as excellent or good, when in fact 42% claimed they had one or more chronic illnesses, Drummond, 2008. The latter point suggests that men overestimate their relative health and clearly delay care of potential serious medical issues," end quote. And it just really encapsulates the issue, right? I myself, I'm a person in long-term recovery. I'm a person that's been diagnosed with bipolar 1. I work in behavioral health. I'm the director of community outreach for a behavioral health organization. And what we see is that people with physical and or mental health issues are not seeking help. They're not getting the appropriate treatment. And, you know, anxiety and depression and self-esteem issues, self-image issues, neglect, abuse, trauma, things that happen at childhood, left unaddressed, often lead to bigger problems. And one of the most, the biggest contributing factors to substance use disorder is often undiagnosed or untreated mental health illness. Mental health illnesses or traumas or different childhood experiences. There's a study on adverse childhood experiences that shows if an individual experiences one or more of these things, and for each of these experiences that they have encountered, it increases their likelihood of becoming substance use dependent in the future. So my appeal is this: let's break the stigma of men asking for help. It's okay to be vulnerable. It's okay to ask for help. It's okay to be emotional. It's okay to be sad, to be depressed. If you feel pain, seek medical attention. If you have emotional issues and you're suffering with mental health, please seek medical attention. Stress can be one of the leading causes of different illnesses within the body as well. Stress releases these different chemicals in our body that creates problems for us. So again, as a person in long-term recovery, I wish I was honest about my issues. I wish I had sought help at a younger age when I was struggling with anxiety and ADHD and, this self-esteem issue that I had. Maybe I would have diverted myself from, a lot of pain and a lot of struggles for my family. But that being said, now as a person in long-term recovery, I'm a big physical health advocate, I'm a mental health advocate, and I'm an anti-stigma guy. I just want to get out in the world and let people know men do recover, men do get well, and it's okay to be sad, to need help, to ask for help. It's the most courageous thing you can ever do is ask for help. Don't suffer in silence. Thank you.